Imagine a surgery where 3 people end up dead: the patient, the surgical assistant, and an innocent bystander. It's only been recorded once in history. In 19th century England, there was apparently a 300% mortality rate surgery. Did this really happen, or was it just a gruesome myth? I'm Maddie Massey, and I talk about weird and wacky science. Let's go back to the start of this story. It's 1808, and a precocious boy, Robert Liston, is starting his studies at the University of Edinburgh, and he's only 14 years old at this point. Only 2 years later, at 16, he starts his medical studies, and by the age of 20, he's fully qualified as a surgeon. So he's kind of like the old-timey equivalent of Doogie Howser. So Liston eventually grows into a tall, very confident, and sometimes intimidating man. He's a fearless and a bit arrogant surgeon, taking on patients who other surgeons would refuse to operate on. At one point, he moves to London and becomes known as the fastest knife in the West End. Okay, so these days, surgery is a painstaking, methodical, slow process that can sometimes take hours, but it was very different in the early 1800s. For example, there were no blood transfusions, so the longer that the patient was on the table bleeding, the more dangerous. And there was no anesthesia, so the patient would literally have to be held down screaming while the surgery was happening. So that meant that surgeons would have to work as quickly as possible. So before he performed an operation, Robert Liston would typically stride into the operating theatre, which would be packed with spectators. In these times, it was normal for medical students, other surgeons, and even members of the public to watch these operations. And like a magician or the greatest showman, he would nod to the medical students who were present with their pocket watches, and he would announce quite loudly, "Time me, gentlemen." Liston's surgical assistants would hold the patient down and then put a handkerchief or a towel in their mouth to mask the screams. And one of his most popular procedures was limb amputation. Liston would cut through the flesh with a sharp knife, saw through the bone, and then close up the wound, all within 2 to 3 minutes. Shockingly, his fastest ever amputation was 28 seconds. And his results were pretty good for the time. So 1 in 6 of Liston's amputation patients would die from infection or blood loss or some other complication after the surgery. And that's compared to 1 in 4 being the London average at the time. But sometimes, in his haste, Liston would make mistakes. During one leg amputation, he accidentally removed the man's testicles as well. And Liston's most famous case is the only operation in history to have a 300% mortality rate. So this one was another one of his high-speed amputations. Liston was in such a rush to take off the patient's leg that he accidentally cut off the fingers of the surgical assistant who was holding onto the leg. He also slashed through the coattails of a spectator who was so freaked out by the whole incident that he died on the spot. And a few days later, unfortunately, both the patient and the surgical assistant died of gangrene. Gangrene was a really common problem after surgery back then, when people's wounds would get infected with bacteria and the skin would become swollen and dark coloured and foul smelling. Anyway, the bacteria and the toxins that they make can easily spread to the rest of the body and cause death. So that surgery had a terrible, historically terrible outcome, and it made Robert Liston infamous for centuries after. But it's uncertain how much of this particular story is grounded in the truth. The 300% mortality rate surgery was first mentioned in a medical history book in 1983, but there are no mentions anywhere before that. And there aren't any details about the date of the surgery, the patient, or where it happened. Could it be possible that this surgery actually never happened and Robert Liston is being unfairly demonized? Let me know what you think.